So, Bismillah, peace be upon you, on everyone. Dear friends and colleagues, we have started a new program that is related with parentings. And we are lucky, thanks God, we have expert speakers with us who would help us to understand some of these questions related to parenting. So in that regard, we would like to ask our speaker, Dr. Habiba, to provide a little introduction of herself. Dr. Habiba, please introduce yourself.
Yeah, thank you so much, Dr. Abdul Rashid, for involving me in this noble cause. And my name is Nusrat Habiba, and I am a pediatrician, and I have experience about like 40 years as a doctor. I work in the University of North Texas Health Science Center in the Department of Pediatrics and Women's Health as associate professor. I see patients, I teach the students, I teach the parents. So I have been doing this. And also I'm a parent and a grandparent. So with that, I will try to answer the questions and help our community.
Okay, that's very good news. Alhamdulillah. Thank you. And we also have our expert in the subject of psychology and psychiatry, Dr. Najeeb. I would ask him to quickly please introduce himself. Dr. Najeeb, please.
Assalamu alaikum. Thank you very much for inviting me. It's a great pleasure and honor and a humble experience. My name is Dr. Najeeb Ranwal. I got my training from UT Southwestern Medical Center in psychiatry, did a couple of fellowship in geriatric psychiatry and research in geriatric psychiatry, did a lot of research over there, published papers, and now I'm working with Dr. Rashid in a lot of education programs, and there we go. And whatever I know, I can explain in that behalf.
Alhamdulillah, this is we are very lucky to have these expertise with us. May God Almighty reward them for their services toward our community. So let's go ahead and start with our first questions. So the first questions that we have is, how should parents handle children's challenging behaviors such as throwing tantrums, crying, screaming, sulking, and whining? So I would like to have Dr. Habiba elaborate on this question, please.
Yeah, mostly, the toddlers, they do this, they throw tantrums, they'll do like crying, screaming, sulking, and whining. So mainly, number one, they are not happy, of the situation. They try to do that. And many times, they this is attention seeking behavior. Maybe sometimes they want the attention of the parents, so they throw tantrums. That way, the parents will come to them, and then so they will attend to them. That is attention seeking behavior also. Or sometimes, if they are not happy, they want something, they do these behaviors. And these behaviors can be changed. Children are developing, and then so these behaviors can be changed. First and foremost, when they are throwing tantrums or crying, we need to distract them, and so that they can stop that. And afterwards, when they are calm, at that time, if you are going to teach them, they are not going to listen to you, and they are not going to follow that. So when they are throwing tantrums or when they are crying and screaming, at that time, you distract them and make them, stop that behavior. Then later on, when they are calm and when they are in the listening mood, at that time, you need to tell them. So, this is not the way. Okay, you want something means you need to ask like that. And then also you can tell them in a story telling form, right? So you can imagine a child, same age of your child, so a girl or a boy, then that child is going to be a good girl or a boy, And then, so she does, when she wants something, she does like that. She will go and ask, and then like that, So, and say, that child does like this. And then everybody used to appreciate the child. And also, everybody will reward the child like that. And so, and also you tell the child, you are also a good person. Always, always, appreciate the children. Human behavior is, when you appreciate, you want to repeat that behavior. It is not only true in children, it is true in all the human beings. Even like a 90-year-old man, he has, everything he has seen in his life. And then he is like, wearing a shirt. And then you tell him, oh, you look so, this shirt is so nice on you. You look so handsome in this shirt. And then that man will wear that shirt on special occasions, right? So that is the human behavior. So you appreciate the children, tell them in a nicer way. And even if they do a small thing, appreciate them. Oh, you did a nice thing. You were so helpful. So you picked up the thing, and then put it on the table. That was a wonderful thing, You are like that, you appreciate, then they will do the good thing. And also rewarding, it is not, it's not expensive at all. So rewarding can be just a kiss, just a hug, or spending more time with them, like, 5 minutes, 10 minutes, or even like a 10-cent worth something you can give them. So like that, if they do a good thing, reward them. And also you can tell them, if they want something, they can tell in a nicer way. Like that, you give the alternative. How to, like, ask for things. If they are not happy, how to tell you all, like that, instead of like throwing tantrums or screaming, throwing things and like that, how can they tell that they don't like this, something like that. So, Dr. Najeeb, so you comments, valuable comments. Are you able to hear me?
Yeah, I think Dr. Najeeb, yeah,
Oh,
he's trying
sorry
to
about
finish.
that. Thank you very much. I was on mute. So it was a very nice explanation. I really appreciate. And pretty much this is how we do in a normal behavior pattern, because basically the kids are looking at the parents. They are the mode where they are learning from the parents and their behavior. And when the parent acknowledge them, nurture them, in a subtle way, they are looking every sign from them. So it's very important for the parents to be in a positive way, in a rewarding way, and controlling the emotions, very important. Even if something is done wrong, you have to be neutral rather than uh, showing complete emotion. Be neutral. So when the child perceives danger by angry face, by action, they go from the normal mode to defensive mode. And the goal is to them to learn from the parents and not go into defensive mode. So the parent has to take a lot of responsibility in explaining the kid in a normal fashion, in their proper tone, behavior, facial expression, uh, be with empathy, sympathy, and compassion. That has to be there with the idea of nobody's perfect, but we can make it perfect, or we can work on it and go from there. The kid is learning, and we are all learning, and we can work on it rather than punishing them, which is when the kid perceive or feel like the kid will be punished, they go from the normal mode to defensive mode, and they start finding excuses. How can I get out of it? And that's not a good learning. Punishment is never considered the first line of management. It's always try to understand the kid, what they're going through. So usually in psychiatry, that's what being in a normal behavior. Keep in mind that not all kids have the same phenomena. Some people have mental health issues, correct? Some people have anxiety disorder. Some people have ADHD. Some people have other autistic disorder, things like that. The way how to deal completely changes when they have those issues. You have to be more persistent, more receptive. You have to follow the guideline based on the kid's behavior or their diagnosis. The crucial thing comes up is that kid has maybe a mild ADHD or mild learning disorder, has never been diagnosed. Because the parent thinks my kid is normal. There's nothing wrong with my kid. He's very just stubborn, or he's very strong-willed. And it will take time. Not realizing that, and they go into the mode of punishment, and then the kid realize that defensive mode. It goes into defensive mode, and there where the trouble start, that being in ADHD or learning disorder or something which is a very subtle way, if they are in, they learn differently than as a normal person comes. So that has to be kept in mind, that if somebody has behavior which is concerning and persistent, get help, rather than say that he's strong-willed person, that he's moody, that if you feel concerned as a parent, that's a first red flag. And if you're constantly feeling concerned, it will be a suggestion to go and see a physician to get help also, like just to know that where the kids stand. And pediatricians are very good in it to catch early that this is a normal behavior and you should not worry about it. Because basically, if somebody has those behavior, they can be bullied down the line, because they have some learning disorder, mild learning disorder, and they're competing in a good school district. So they're down the line, they get bullied and put down, and that goes worse and worse. And after 5, 10 years, they are diagnosed, and a lot of time is being lost. So it's very important, if a parent sees something concerning, and is persistent, and getting worse, don't stop yourself, get help, go to a pediatrician, child psychiatrist, or anybody, and get just opinion about that. And if you get a clean bill of health, that's good. And go from there. Other thing which also comes in mind is how you train your kid, because the kid always looks at their parent as a primary source of learning. If there's a lot of fight going at home, bickering, fighting, things like that, uh, physically aggressive, the way the demeanors are not good, they're not following the direction, and then they expect the kid to do normal behavior, that does not jive with the kid. Kid will listen to it, will understand that it's in the subconscious mind, remembers it, and then later on they will do exactly what the parent did. And after 12, 15 years, they will say, you did the same thing, why you're stopping me? So the parents needs to be very receptive to understand that it's a lot of task for them. Even every minute counts for them, how they're behaving with the kids, how much time they're spending with the kids. Are you spending meal time with them? Are you having more conversation, healthy conversation with them? Or are you watching TV or internet and there's no communication between the kid and the child? Correct? That's not a good, healthy way of nurturing and raising your kid, because if you spend most of the time in school or watching TV or internet and go to sleep, uh, basically there's no healthy discussion or timing between the parents and the kid. And that's all. If they learn this thing for 5, 10 years, we have changed the roles of the parents, because we are the provider for money, provider for schooling, provider for that, but we have never nurtured them the way the parent needs to nurture. And that's a very difficult task. I totally get that. And parents have told me that they have to do a lot of work, but it's something they have to keep in mind, that you have to spend time with your quality time with the kid. And once they see your quality time, the way your interactions are, they learn it. Even a youngest kid, like 1 year, 2 year, 3 year old, they're observing you. how you are behaving with them. So that's a healthy mechanism. It's a very tough job for the parents, in spite of a lot of things happening, but everybody do the best they can, I understand, but it's good to know this thing before you proceed. Hopefully they don't have issues, but if you have issues, please go to a physician or health counselor or anybody who can help you and go from there. That's my take from that. Hopefully I answer your question.
Thank you. Thank you, Dr. Najeeb.
I would like to also, as a parent, sometime we have seen that some parents, struggle who introduce devices to their children as a mechanism to feed them, and they struggle their later on to remove the devices when they are eating. So as a result, children gets this kind of habit of watching while they are eating. So that actually bad for building a relationship with parents and siblings in house when they are together. So, would you recommend any kind of strategy or technique for parents? First of all, they shouldn't introduce devices to feed children from the early ages. If they have done so, how they can correct it? And now that children got kind of used to having iPod or cell phone, watching cartoon, and either the child eating or the parent feeding child while the child is engaged in a TV or cartoon or other activities. So my observation was that this reduced the interaction between the child and parents at a very minimum level, where eating should be a fun activity. It's a relationship building activity between the siblings and the parents and other family members. But right now, since children are dependent on the devices, so there is also, I have also noticed that there are some side effects from it. Like now, children don't really understand the value of the food they are eating, because their attention is not in the food, rather their attention is on the devices or the program they are watching. So over the time, they actually don't appreciate the food that in front of them, and they are not kind of knowing what they are eating. So as a balanced food wise, even though it's a parent's responsibility sometimes to provide them, but if children are not knowing what they're eating, do not appreciate the food because their attention is not on the food, that cause health effect later on, because they will be eating just junk or other stuff rather than focusing on their food, because their attention is not food. Would you suggest any kind of remedies for the parents, how to rectify this kind of behaviors for the children, so that children, it would be a shock for the children to come to the dining situation or lunch not having these devices at the begin with? So what would parents do to help the children to separate themselves from these devices during the eating time?
So number one, so it's all the questions, the behavior of the parents. So it is all interrelated. Dr. Najeeb, he nicely pointed out, it is role modeling first and foremost. The parents, once, they decide to have children, they need to forget, about their own, yeah, they are not one person, it's a family and they are bringing up the children. So they need to be role model. The children, you are advising something and you are doing something, means the children will copy you, what you have been doing. So there is no point in advising them. So first and foremost, they should not do while eating, they should not watch TV or talking and iPad, iPhone. So first they need to practice that, and then don't even introduce that. So once it has been already introduced, then there are other ways to like cut it down. But okay, feeding the child, that is the time the mother, a small child means that is the time mom is with the baby. So that full time, let mom concentrate on the baby instead of giving like a phone or something like that, iPad. She can talk to the baby, tell some stories and things like that. So the baby also engages with the mother, and like that you can do. Then later on, little bit bigger children, the try to everybody eat as a family. All Everybody try at least one meal. The whole family should sit down and eat. At that time only, it is a family gathering. No distraction, no iPad, no iPhone, no TV. So you just like talk, find out how the school was, talk to the children. That is the time coming together and talking. So you talk and eat. And so first and foremost, role modeling. So that is one. And then don't even start that habit of giving the iPad and trying to feed the child. So don't do that. Yeah.
Yeah, thank you. So yeah, it would take some big decision on parents and so of course to change it, since some parents already got this habit, they will have to cut down slowly. Do you think there are other alternative mechanism? I know one time Dr. Najeeb suggested that introduce a game, just guess a verbal game, asking them questions like you mentioned, or who is who, things like children enjoy talking, or knock knock joke or something that children are used to nowadays, to replace those kind of device influence on their behavior. I think that probably can work. But I like the strategy, at least having one meal, even though in the United States sometime majority of the parents are working, they don't have time, but we should at least try to have at least one meal together where there will be no distraction. That is really helpful. I think that answers majority of the questions, the majority of the points we have raised from the first question. I think we are almost at the end of the time. So any other final comment before we end today, Dr. Habiba?
Yeah. So mainly, the parents, first and foremost, I will stress role modeling. So the children, see what you are doing. And even you need to be like nice to each other, nice to your spouse. That way, same, be respectful, be like listening. So all those behaviors they will learn. And you are not respectful, and, the child is not going to be respectful with others. So even though you teach the child to be respectful, but the child is seeing you, so you need to be a role model. You know the responsibility, and you have been any kind of behavior before, but once you have a child, then you need to change the behavior for your child's sake. So yeah, that's very important.
Okay, may God bless you, keep you in good health, and so that we can learn from you. And we really appreciate your knowledge and time you are providing for our community. Jazakallahu khairan. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam.